Frontline, it's Val. How you doing? I want to spend some time today on pain management. Pain management is a really important topic in HIV field. It's been reported that 40 to 60% of people living with HIV right now are likely to be in pain at any given time. And we know that it's more likely that people are in pain as the disease advances. And studies have also shown that people with HIV often don't receive adequate treatment for their pain. And so HIV positive people, particularly current or former drug users and women, are often undertreated for pain. And this doesn't have to be the case. Just as we have HIV specialist docs to provide top care for folks living with HIV, there are pain management specialist doctors and clinics that can provide top care for people in pain. So there are a handful of, more than a handful really, of pain management techniques. We're not going to get into these in detail, but this is to say that there are a lot of options for managing pain. So obviously there are pain management medications, painkillers, of many different stripes, both narcotic and non-narcotic. Physical therapy, massage, chiropractic, acupuncture, visualization, therapy, and cross-diagnosis. So if somebody's pain is, due to another illness that they're living with, we can treat that illness and maybe get rid of the pain without going through any of the other techniques listed above. So if we were all in class right now together, we would have a brainstorm right now to answer these questions. So what I want you to do is think about for yourself how you would answer these questions. Why is pain a problem? And what are the reasons that people with HIV may not seek help when they're in pain? And what are the reasons that doctors may not pay attention to pain in people living with HIV? A lot of that has to do with the idea of using drugs. And so other discussion questions are, what are reasons that people use, and how is that different from addressing the problems of pain? Now we know that people use drugs for all sorts of different reasons, and some of those reasons do have to do with pain, both emotional pain and physical pain. But a history of drug use doesn't mean automatically someone can't use pain medications. And that's different from what is often said in the rooms of AA or NA, and people with a lot of sobriety behind them might encourage newcomers not to take pain medications. And you can understand the sort of, temptation that they think that they're, helping support that newcomer in holding back from. But those years of sobriety doesn't make someone a doctor. And really, pain management needs to be something that is discussed in a clinical setting, not just sort of in recovery group. So communication is really essential in this, and providers can't help address pain unless they know about it. So we recommend that folks in pain consider keeping a journal of when they're in pain, and is it worse? Like, what time of day? Is it in the morning, before bed? Is it constantly? Is it off and on? Is it worse after meals, or after you read something, or after sex, or after exercise, or after the kids come over, or before your weekly meeting that you don't enjoy going to? Like, when these things can be, they can help point to what is the cause of the pain and what might be the best treatment for it. And the other thing is to understand how pain medications are supposed to work, and ask your doctor to explain until you understand. Because the one of the things that makes taking pain medication very different from using is that pain medications are prescribed to be taken in a particular way. And if somebody is taking them in that particular way and getting relief, they're not using. If somebody is not taking them as prescribed, then that might qualify as using. but the sort of presence of those drugs in the system doesn't mean that someone's using. And that, it can sometimes be hard with, dealing with folks who are in recovery houses or court mandated things who get urine tested that, they come up for narcotics, but it's because of their pain management. So this takes a lot of coordination of care. And if this is anything that you're going through or want help with, I can be a resource for that, at least to, brainstorm with you ways to get what it is that you need. Because here's a couple of slides of the bottom line. Suffering should be minimized. Everybody's pain tolerance is different. And if pain is interfering with anyone's life or with the quality of their life, it's real. It's not just something to get over or ignore or forget about or stop whining or any of that. It's real. And remember, we're fighting for the best possible quality of life for all people living with HIV, not just, well, you're alive and your life sucks, but you're alive, so shut up. And this point is, it can be really difficult to express. A lot of times people think that they deserve the pain that they are living with because of things that have happened in their past, things they've done in the past that they might not be proud of. But pain today isn't actually payback for anything from the past, and the past is done. And anyone who sort of says or encourages you to believe that you deserve the pain that you're in doesn't deserve to be in your life, in my opinion, because all people deserve treatment for pain and suffering, and no one has to suffer in this life. So that's the end of this. Please join us in the discussion forums so we can continue the discussion in the forums. Okay, bye.